Good morning and welcome to San Diego People. I'm Alan Denton. If you don't have health insurance, the deadline to sign up for the Affordable Care Act is fast approaching. Most states have their own health care exchange. Ours is Covered California. Today we'll talk with some experts to see how the transition is working, and we'll try to determine what the future holds for most people who refer to it as Obamacare. But before we talk to our guest, KUSI's Sasha Fu takes a look at how consumers are responding to Obamacare in the remaining days before the deadline, which has been moved once again.
We're seeing about probably 10 to 13 patients a day with each of our counselors.
Elizabeth Leal is busier than ever. She's one of 16 counselors at the Vista Community Clinic who is putting in extra hours.
So we show them exactly what they would be paying and what the subsidy will be for them.
She's getting patients qualified and enrolled in the state's new health insurance marketplace known as Covered California.
I feel a personal satisfaction when they get enrolled and, they're going to be continuing their health care, they're going to be healthy, their family will be protected and covered.
With just one final week before the deadline to sign up, community clinics around the state expect a flood of last-minute applications.
The Vista Community Clinic is one of the bigger healthcare systems here in San Diego County with 5 separate locations. About half of the patients that come through this system are uninsured.
For those with little or no health insurance, San Diego's network of community clinics has always offered a safety net.
Do you think it's a good thing for more people to have health insurance?
Nanette Stam, a clinic administrator, says a broader base of insured could mean more financial stability for community clinics.
If we have a larger base of our patients that have health insurance, then we're able to serve even more of those that, for whatever reason, didn't get in on the insurance or don't qualify for any of them.
The state officials running the exchange say enrollments are surpassing expectations. Here in San Diego County, more than 76,000 people signed up in the 5-month period ending in February, exceeding projections by 179%. In LA County, 241,000 people have enrolled, 136% over the number projected. And in Orange County, enrollments are almost double the number which were anticipated.
As of January 1, we started to see new patients.
Gary Rada with the Council of Community Clinics says his members are gearing up for the new enrollments by hiring more staff.
They've been getting ready for that. They've been hiring a number of new people, from whether it's a physician to the back office, to be able to help with all the different aspects of clinic work.
Insurance broker Craig Gusson hasn't been afraid to voice his concerns about Covered California.
For the new people, the hardest part is how do we fit it so that they can get a plan they can afford.
He cautions that the rates for Covered California this year may not be the same in 2015.
We don't know how many claims are going to be out there. And if claims go up a lot, then they're going to have to raise rates.
Under the Affordable Care Act, there is now a penalty for those who don't obtain health insurance. A fine of $95 or 1% of your gross income, whichever is greater. If you don't meet the Obamacare deadline, you'll have to wait until October to enroll for 2015. In the newsroom, Sasha Fu, KUSI News.
And joining me right now to explore how Covered California is working are our guests, and we want to introduce those people to you too as well. Are John O'Haney, the CEO at 211 San Diego, and Jan Spenceley, the Executive Director for San Diegans for Healthcare Coverage. Hope I got that right. Jan, let me begin with you. Where do we stand right now on the numbers? How many people have signed up for Covered California?
At this point, well, you mean overall in the state? It's almost close to 1 million as of February 28th. That's the last. Those are the last numbers we have, February 28th. And I would say it's over 1 million people, is what I understand from their press releases, have signed up. In San Diego County, as of February 28th, about 80,000 Covered California, over 100,000 Medi-Cal.
Yeah. What's your take on the extension of the deadline now to April 15th, I think is what it is, right?
Well, it's an extension, but it's got conditions. Those conditions are that you have to have started your application, created an account and started your application. And that doesn't mean just opened it. It means get a couple steps in. But and if you've done that, then they will let you go further if you had trouble getting through.
So basically what I was reading earlier this week was the fact that what's happening now is if you tried to get online, you had problems and you couldn't enroll, then you qualify for an extension.
I'm talking only Covered California, because earlier this week it was only the federal site. Today, and it was just coming out today, that's breaking news, Covered California has said that if you have gone online and started an application, started an application, that means taking a few steps in, and you had difficulty, then you can have an extension. You can't have an extension just because you went online and looked.
Right.
You've got to start that application.
Yeah. John, from the standpoint of projections, you deal with a lot of people and you steer them in the direction of Jan's folks. I mean, what are you hearing? What are you seeing now?
Absolutely. Well, 211, we're receiving thousands of calls, about 1,200 calls a day, and just people inquiring about this, we're getting about 200 calls a day related to whether it's health needs and in particular questions about how to enroll and do they qualify for Covered California.
Jan, one thing that I'm really curious about, what's happened to those young invincibles? We're not seeing those people sign up. Why have so many chosen not to sign up? What's going on right there? I know you've got some, but still there are a lot out there, and this program depends heavily on that.
You know, we're not sure exactly why, because we have finally gotten into San Diego State. I can tell you that every time we do outreach, almost everybody in the room signs up to get assistance with coverage. So I think, one, to answer your question, they're young and they're invincible. And they have very tight budgets. And they assume that this is unaffordable. When they get in, they find out that it isn't, that they actually can find an affordable option for themselves. So we've not had that experience. I think it's just, when we talk to them, they sign up.
John, what about you? What do you hear? I mean, from when I've talked to some younger college-age kids, and say under 30 to be exact, some of them say the premiums are too high. Others say, you know, why do I need health care insurance? I can pay the penalty and be just as well off. You know, is that, what are you hearing?
You're getting a lot of questions. I mean, I think a lot of it is based on they don't know. So they might be hearing from a friend and then they're repeating it, and that's their take on it. So a lot of it's word of mouth that they're hearing, not necessarily the facts. So when people call 211, they can dial us 24 hours a day. And we have bilingual specialists, 200 languages supported. They're going to get a trained specialist that understands Covered California and can explain it to them and can explain their options and can explain some of the things that they might be hearing but not really understand.
Jan, what about the Hispanic community? How is that going so far? I know initially there were some problems there with the website as well.
Well, early on, the Spanish language materials, online and applications were not available. And that's true. But I actually don't think that was the biggest problem. And I think that because what we've learned within the Latino community is it's very much a word of mouth community. They want to hear it. They don't want to, they're not as much into the websites and not as much into using the technology. They want to talk to a person and they want that person to tell them that things are going to be okay. What we've seen is word of mouth. One neighbor tells a friend, tells another friend, and it's just been steamrolling. The numbers for February were significantly, the growth in the Latino community was significantly higher than it had been, and than it was in other communities.
And just from our perspective, almost half of our callers are the Latino population the past couple months.
Yeah, we've heard about sticker shock when people find out about what their premiums are going to cost them in some cases, and I even talked to a couple of people when I was out one day eating lunch. A waitress, in fact, said, you know, her premium was going to double, and she said, "Have you guys done any stories on this?" And I said, "Well, you know," and this was when it was first launched. What about the premiums? What are you hearing from people?
Not that at all. And in fact, people that come in angry because of all the cancellations, and this is what happened early on. A lot of people were canceled. We heard that these Covered California rates were going to be 50% higher than the market. They aren't. They're lower. And they actually are better coverage. So what we've found is that people come in with a chip on their shoulder, leave happy. I've had people crying in my office over the fact that they've finally got affordable coverage. So we've had one person out of hundreds that has said it's too expensive for me once they find out what it is.
Not a bad rate. All right, we're going to continue our discussion in just a minute. All right, coming up, we're going to talk with a broker and expert on Obamacare, and we're going to look at the impact it has had on your health care plan, and we'll hear from a local businessman who is faced with some difficult choices under the new health care law. Stay with us. We'll be right back.
It's the battle of the RV dealers, the RV Super Sale. San Diego's major RV dealers go head-to-head competing for your business on new and used RVs. They battle for your business, and you're the winner. Hundreds of RVs on sale. The RV Super Sale at Qualcomm Stadium.
Hi, Joan. I'm from Coit. Show us your dirt.
Come on in.
The granite is definitely a problem. Look at the film on here. So then over on this side, look at the water stains we have over here. Look at my shower, the tile and the walls and the grout in here.
Coit can clean that.
Right now, save 40% on carpet, upholstery, air duct, drapery, wood floor, tile and grout, and natural stone cleaning.
It never looks so good. It looks like it's brand new to me.
Right now, save 40% on all Coit services.
Your retirement years at Casa de las Campanas. They're your best years.
It's like a cruise ship on land.
The independent, active lifestyle you want to enjoy now.
This was the place for us.
And knowing you're always safe and cared for in the future.
And I wish I'd done it sooner.
The retirement you've earned. The retirement you deserve.
Welcome. Come ahead. You're going to have a great life.
Casa de las Campanas awarded 2013 San Diego's best retirement community.
The magical world of Don Quixote is brought to life at San Diego Opera Saturday, April 5th. Though mocked and rejected, Don Quixote pursues the impossible dream, capturing the heart of the woman he loves. Full of Spanish rhythms, windmills, gypsies, and bandits, Don Quixote runs through April 13th. For tickets, call San Diego Opera 619-533-7000 or go online at sdopera.com.
It's the battle of the RV dealers, the RV Super Sale. San Diego's major RV dealers go head-to-head competing for your business on new and used RVs. They battle for your business and you're the winner. Hundreds of RVs on sale. The RV Super Sale at Qualcomm Stadium.
And welcome back to San Diego People. Right now I'm joined by Craig Gusson, an experienced broker and expert on the various covered California plans. Also with us today is healthcare advisor John Douglas. Gentlemen, thank you both for being with us today.
My pleasure.
Craig, let me begin with you. Your experience with the Obamacare process, obviously a lot of confusion about the healthcare coverage plan. Tell me about what you're seeing right now.
Well, the confusion right now is people are saying, okay, I need to buy it. But do I buy it now? I'm hearing it's going to be delayed, maybe I'll wait a week. And I'm saying, buy it now, because I'm afraid to see how bad it's going to be. If we look at December, when you had to apply by December 22nd or 23rd, it was an all-day event trying to get applications into covered California. Now, the big issue is that no one's talking about, if they do delay it, which you're now hearing that they are the insurance companies delaying it? Because you may say covered California says you can buy it, but what we saw in December was that Blue Cross, Blue Shield, all the insurance companies were not offering you coverage with a 1/1 effective date, at the end of December. So it may be that you can go to covered California starting on Monday and buy health insurance, but you can't go to an insurance company and get it with a May 1 effective date. So that's something I'm curious to see what the insurance companies are doing, because again, you've got covered California, and then you have the insurance companies who do it outside of covered California if you're not going to get a subsidy.
So we still don't know what's going on there. John, as you look at it from a business owner standpoint, what challenges do business owners face right now with all this going on and the extended deadline now until April 15th for most people?
Sure. First and foremost, the April 15th deadline isn't a concern as it relates to business owners because they're primarily working with group plans that insure their employees. So we're not under any constraints in that respect. The primary concern as it relates to 2014 is rising premium rates that are quite a concern, as well as reduced access to favorite doctors and just uncertainty. I think those are the primary issues.
Craig, Covered California is convinced they have a success story. They've touted it quite a bit, one of the best programs in the country, reportedly. Do the numbers tell the story?
I hope so. I don't know, because again, we don't know the bottom line numbers. We know that over 1 million people, I think it's in California, I think it's 1 million people, have signed up. How many have paid for it? I look at the agent community. The insurance agents in San Diego County and in California accounted for 80% of all the business cover California got. So they did do something right by including the agents and having us. I think the more they use the agents to help the consumer, because a lot like Jan said before, and that is that you need to have people, they need to have a one-on-one relationship with somebody. Some people will be willing to talk on the phone, but I think if you get that one-on-one and get a bigger outreach to people, you're going to get more people signed up. Was it successful? Yes, to a point, But again, we don't see all the numbers yet. And the number one question I've been asking since day one, and we've talked about on here many times, how many of those people had health insurance in December? And we don't know. I hope we do find out and see, did we really increase our number of people going from uninsured to insured? We don't know yet.
So let me toss this out there to both of you. What options do consumers have if they miss now this April 15th deadline? What goes down at that point?
They can't do anything till January 1st, 2015. There's no way to buy health insurance except for what we call a qualifying event. A qualifying event is you lose your job, you get divorced, you have a baby, you can add the baby to a plan. If you join a company, you can come on the company plan. But I know someone's going to call me up in June and say, I want to get health insurance. And I'm going to say, well, the last time I had it. And they said, oh, I haven't had it for a while. I can't get them health insurance in the United States of America until January.
I might add there's a couple other options. Number one would be if they work with an employer and they're full-time, the employer would have an open enrollment depending on when their plan renews, and that would be an opportunity to get enrolled at that time.
How would both of you rate Obamacare from the standpoint of the key objectives that was initially set out in that mandate? How would you rate it right now?
A C.
Really?
Yeah. I was going to go with a D or an F myself.
Really? I was going to be nice.
And give me some of the reasons why. What stands out the most?
They didn't design it the right way. They could have taken the existing plan, left it like it was, and used the subsidy money to help the people who really need help. Because when you get somebody making $30,000 a year, and I tell them I can get them a plan for $1 a month, something they can really afford, but they got a $5,000 deductible, they can't afford a $5,000 deductible. So I would have designed it better. And the example I always use is, if you go to get a car loan, they look at your FICO score, and based on that is depending how much you're going to pay. Well, if you have a plan you like, you keep it. If you're uninsured and you can't get health insurance, let the government help you. Let's put together a base plan that's always there for everybody, so that everybody can get insurance. And if you want a better plan, you can get it. We have that with business insurance, with group insurance, a lot of options. I do think that's what they could have done better. I think they should have anticipated a lot of what happened. We didn't have a direct line to cover California till about a month ago. They needed to be more prepared for it, and they weren't. And it's been real frustrating on that part. But we're a lot better than the federal exchange.
John, from a business owner standpoint, what would you do if you had it to do over again differently?
Sure. I think the biggest concern, and I certainly would echo some of Craig's sentiments that are certainly on the mark, I think the biggest concern was we had a system that was strained, but it was not broken, and we've pretty much disassembled it and tried to reassemble it, and that was for the benefit of a small minority of people who were potentially uninsured, and many of the uninsured, frankly, weren't concerned with being uninsured, and so now we're kind of forcing them to be insured in some respects, and I think in many cases they'll be happy to pay the penalty as opposed to the premium. I think that to change the system and impact everybody, employers and individuals alike, for a small number of people that may have been adversely impacted by rules of the insurance carriers as well as the pricing, was not thought out properly. That would be my answer.
But we're not finished yet. We're going to continue our discussion. Okay. Still ahead on San Diego People. We'll talk to the entire panel, and we'll look at what happens after the April deadline has passed for both Covered California and Obamacare nationally. Stay with us.
You deserve more, and Time Warner Cable is here to help you get it. With our exciting new offer, you'll get the best in entertainment at a great value. For a limited time, you can get HBO and Cinemax free for 3 months when you sign up, and get free installation with qualifying packages when you call by March 31st. Get a bundle with TV and internet starting at $64.99 a month for a year. So call 1-855-1TWC now, because this offer ends March 31st. Time Warner Cable. Enjoy better.
I like my chances.
As part of its Good Neighbor initiative, California College San Diego is now offering hundreds of Fresh Start scholarships. Hundreds of people just like you are making a fresh start toward a real career and a better life. These Fresh Start scholarships are for adults, and they're not based on high school grades.
Yes!
With a Fresh Start scholarship, you can afford to go to college, but they're going fast. So call 619-450-1112. And when they're gone, so call today. 619-450-1112. California College San Diego. Degrees designed for careers.
Imagine instantly and effectively removing any unwanted fat from your body. With body contouring from Sonobello, it's possible. It's why more than 35,000 men and women have trusted Sonobello for targeted fat removal that's more convenient and more affordable than it's ever been before.
Sonobello was the catalyst to get healthy. I have the body that I had in my 20s.
Sonobello physicians specialize solely in body contouring, and it's how we achieve such incredible results for our patients time after time.
You can have the slim, toned, sexy body you've always wanted.
I love my Sonobello body. My husband loves my Sonobello body.
Now it's easier than ever to get your sexy back with Sonobello. Call 1-800-421-5452 or go online now for a free, no-obligation consultation. Learn how quick and affordable your procedure can be. Call 1-800-421-5452 for a free consultation or go online now.
Guests are back right now to take a look at where we go from here. But before we talk about that, Jen, let me get back on one other topic I didn't get a chance to talk to you about earlier in the first segment. I've seen numbers anywhere from 13 to 15% of enrollees still haven't paid their first month's premium. What are you hearing from that standpoint?
I'm hearing that a lot of people have attempted to pay their premium, and I think the health plans are a little bit behind. And not all of them. Some of them have better systems for invoicing and getting those invoices out, and some of them don't. Some of them are actually enrolling people in advance of having a premium paid. I'm not seeing a lot of cases of people not paying, but I wouldn't have those statistics. I think some of it's systemic. You know, the system's just catching up, and it's a new process.
Sure. Let me toss this out to all of you and just go down the line here. The Affordable Care Act was actually passed, if I understand it, about 4 years ago. It was signed into law. The Obama administration clearly keeps moving the goalpost. We've seen that just recently. Is that any kind of an indication that the Affordable Care Act is unraveling at this point? And does it need reforms?
I'd love to take that one. I think they put it together and they try to do the best they can, not realizing what they were doing. Because you had people who weren't involved in it on a daily basis to really understand what we all know. So they've taken it and they've changed it to try and make it better, but I still think it's got a lot of work to do. And I'm hoping next year it'll be a lot better and a lot smoother and a lot easier. But right now I just think that they did a lot of things that we were talking about a year ago that wouldn't work, and that's why you saw the employer mandate get put off. And you're seeing all these reasons get put off. And I do think it's going to take time for them to get it right, if they get it right.
John?
I think they complicated the system. They didn't think it through. There were politicians that were making decisions as opposed to really involving the insurance community as well as employers. I think one of the big issues that we see is the fact that the catastrophic plans were quite popular amongst businesses as well as business owners, and those were more or less stripped from the marketplace, and so those rates skyrocketed. And I think a lot of people started realizing I want insurance for catastrophic reasons, not for every time I go to the doctor or the pharmacy. And I think there's a lot of good sense, good common sense in that, and that has been stripped away from the system. So I think it's also impacted affordability for a lot of people in a very harsh way, and that was not the intention, but that is now the reality.
John, your thoughts on that question?
Well, we work with lots of programs, Covered California being one of them, and we just noticed that with any program, especially a new program, it takes time to get off the ground, and I think having someone live 24/7 at 2-in-1 is a great way to just make sure that people can have someone to talk to when they do get caught up or when they do have questions. So we're happy to play that role and continue in that.
Jan, we talked about this earlier. What will it take to get those young invincibles back into the market? I mean, the program is so dependent on that, right?
I actually am thinking that most young people do want coverage, and there are catastrophic plans available to them. I consider them rather catastrophic. $5,000 deductible is way higher than what most people would think is reasonable. And so I think that there are options for young people, very affordable options. I think it's just education. And I honestly believe that. Once we educate people, they are enrolling. And so I don't experience the same issues. I also want to go back to something else.
Okay, sure.
You asked that question. I wanted to be the last one to answer it, about the system and moving the bar and whatever. This is a huge undertaking, and other countries have taken years, decades to perfect their system. We're just embarking on a new adventure here.
Right.
And so I think it's really way too soon. We're just leaving the starting gates. You can't judge a program like this until we get farther down the road. And the whole point of this is making a healthier community. The whole point of this is having a healthier country, lowering healthcare costs by making sure that everybody isn't having catastrophic events as opposed to having some prevention and focusing on wellness. So I think I don't think we should be making judgments this early in the game.
Yeah, but we've got to admit there's been a lot of confusion. I mean, Kaiser did a survey that